The member for Canberra.
Thank you, Speaker. My question is to the Prime Minister. The Royal Commission heard evidence that aged care workers could only use 2 masks or 1 glove per shift. How can residents and staff be protected from the deadly COVID virus when staff can only use 1 glove per shift?
The Minister for Health.
Thank you very much, Mr Speaker, and I want to address this question and correct some of the claims made. In relation to infection control and in relation to PPE, what we have seen across the country is at a time when there was a global shortage and of supply and a global spike in demand, Australia has been one of the countries that has been able to not only maintain but to dramatically expand our flow. We've had over 400 million masks into the national medical stockpile. We've been able to secure masks through to the end of the year. We've been able to secure gloves and gowns and to provide them. So far, the advice that I have is that more than 69 million masks have been dispatched from the national medical stockpile. That includes 14 million masks to aged care facilities around the country. What that also includes in particular is 10 million masks dispatched for Victorian aged care workers. It includes gloves and gowns and other items such as hand sanitizer. All of these elements have been fundamental to ensuring continuity of care. The National Medical Stockpile, if it receives a request, will process it as a matter of urgency in relation to a facility. On multiple occasions, we've issued new rounds of support. And only yesterday I noticed that there were some tens of thousands of masks made available to Victorian providers. So the correct answer is that gloves, gowns, masks, hand sanitizer have all been made available through the National Medical Stockpile. Historically, and the National Medical Stockpile was only responsible, amongst those things, for the masks. We made sure that on our watch, in our time, gloves and gowns and sanitizer were added to the stockpile. That was over and above what had previously been agreed with the states as the responsibility of the states as opposed to the responsibility of the Commonwealth, but in this time, on our watch, on our responsibility, under the guidance of the Prime Minister, we took those decisions to add. So all of those elements have been provided, but as of coming here today, shortly before joining you, the National Incident Centre has advised me 69 million masks, of which 14 million have been provided to aged care and over 10 million to Victoria.